The WA Country Health Service is privileged to provide healthcare services to communities across regional Western Australia, including the Kimberley. Working in health in this part of WA is truly unique, and it's an experience you will never forget. Our staff are our greatest advocates. Here's what they have to say about working at Kununurra Hospital and living in the East Kimberley.
Kununurra Hospital is the largest hospital of the East Kimberley. It is a place where we would provide support to both Halls Creek and Wyndham hospitals.
We see on an annual average about 40 patients per day. It's a busy little hospital. For a town of about 7,000 people, our acuity is actually very high.
In the ward we've got surgical days, we've got general medical patients, we've got paediatrics and maternity. So I'd never even seen a baby be born before, and I've seen 2 now, which was pretty cool.
I think working for WACS you have a lot more opportunities to get hands-on, do procedures, actually speak to patients and learn clinical skills yourself by the bedside. So I think we just get a lot more front-facing patient care and the opportunity to safely be outside our comfort zone with having some supportive supervisors there.
We're very fortunate to work with amazing community navigators and Aboriginal allied health assistants that work in directly with our team, and we learn from them all the time.
I'm what they call a community navigator. I support the allied health team. They come down to Halls Creek once a month. We help them to bridge that gap. We help them, we try to give them an understanding of what the expectations are in the community, also what the cultural expectations are.
It's just so nice feeling like you're part of a greater service provision, that I actually have some say in how we provide patient-centred care and making positive change towards the ultimate goal, which is, closing the gap and having that community engagement. I just think it's wonderful being able to do that at a grassroots level. That's why I enjoy it.
It's been, I think, personally for me, one of the best moves for my career. I've got to experience so many different clients, fields of work, got to experience some amazing locations in Australia, flown out to remote locations that I probably never would have had the chance to visit if it wasn't for my work.
I've actually bought a house up here. If you'd asked me this time last year if I was ready to buy a house or anything like that, I would have said absolutely not, no chance. But yeah, I just saw this house, thought, love Kununurra, I love being in the East Kimberley. So I guess in that sense, yeah, it has changed my life for the better.
Not only has WACS given me an opportunity for employment and training to develop myself, but also given me a steady career where now I have bought myself a house. So, single mum. Very proud of myself.
I've lived here for 14 years, came here to visit, came here for 6 months, stayed for 14 years. It's not an unusual story in the Kimberley.
There are no downsides to moving to the country. Property's cheaper, your commutes are closer, the fun is on your doorstep. We have a great work-life balance, we've got fantastic teams. There is really no downside to living in the country.
We water ski, we go fishing, we go boating up the river, we go bushwalking, we go four-wheel driving. There's lots to do here.
And my advice is do it. You won't regret it, and you'll have some fantastic experiences. Whether you're here for 1 year, 2 years, I came for 2 years, it's been 12.
It started as an adventure and it's become my lifestyle, and I'm really lucky to live here on Mirrorong country and to call this place home.
If you're up for a Kimberley adventure working for a great organisation where you can meet some amazing people, we'd love to hear from you. To find out more, go to the WA Country Health Service website and search Work With Us, or send us an email.